Okay, let's talk a bit about the nerve supply of the lung. So we said that we have autonomic nervous system. Remind us a bit how the nervous system is in the first place. So we have autonomic and we also have what?
The nervous system splits into two main parts: the central nervous system, brain and spinal cord, and the peripheral nervous system, all other nerves. The peripheral system divides into somatic, voluntary, controls muscles like for walking, and autonomic, involuntary, handles organs like heart, lungs. Autonomic nervous system, for lungs, has sympathetic, from sympathetic trunk, dilates bronchi, and parasympathetic, from vagus nerve, constricts bronchi, boosts mucus. Pulmonary plexus mixes these to regulate lung airway size, blood flow, and secretions. Clear? Want more on lung nerve roles?
So 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 we have autonomic and sensory, you said.
Not quite. The nervous system has central, brain, spinal cord, and peripheral. Peripheral splits into somatic, voluntary, muscles, and autonomic, involuntary, organs. Autonomic has sympathetic and parasympathetic. Lungs get
So
autonomic
we
nerve.
have the central nervous system and the peripheral nervous system. The peripheral splits to autonomic and sensory.
Close, but let's clarify. The nervous system divides into central, brain, spinal cord, and peripheral, all other nerves. Peripheral splits into somatic, voluntary muscle control, includes sensory nerves for touch pain, and autonomic, involuntary, organs like lungs, with sympathetic, parasympathetic. Lungs get autonomic nerves. Sympathetic dilates bronchi, parasympathetic constricts via pulmonary plexus, and some somatic sensory. Examples via visceral pleura, detect stretch. Not just sensory, somatic includes motor too. Clear? Want lung-specific nerve details?
Makes sense. And with the parasympathetic, we have the vagus nerve.
Yup, exactly. The parasympathetic innervation of the lungs comes from the vagus nerve. It causes bronchoconstriction, increases mucus secretion, and regulates airway tone via the pulmonary plexus. Sympathetic nerves, from sympathetic trunk, counter with bronchodilation.
And what about the sympathetic chains of the sympathetic? And what about the phrenic nerve? And what about the pulmonary plexus?
Sympathetic chains, trunks, run along the spine, sending sympathetic nerves to the lungs via the pulmonary plexus, causing bronchodilation and vasoconstriction. Phrenic nerve C3-C5 innervates the diaphragm for breathing, not lungs directly, with sensory for parietal pleura. Pulmonary plexus, at lung root, mixes sympathetic dilates bronchi and parasympathetic, vagus, constricts bronchi, boosts mucus to regulate airways and blood flow. Clear? Want more on their roles?
That's good. Let's talk a bit about lymph nodes and all of that. So we've got quite a few. We have bronchopulmonary, hilar nodes, tracheobronchial nodes, paratracheal nodes, right lymphatic duct, tracheal nodes, thoracic duct, bronchomediastinal trunk, right one, left one, inferior fucking tracheobronchial carinal node, bronchopulmonary hilar nodes, superior tracheobronchial. What the fuck's all this? And put it in a system for me.
All right, let's simplify the lung lymph nodes and organize them. Lymph nodes in the thorax drain lymph, fluid, immune cells from lungs, pleura, and nearby structures, filtering pathogens and cancer cells. Here's the system, grouped by location and drainage. 1. Intrapulmonary and hilar nodes. Bronchopulmonary, hilar nodes, at lung hilum, where bronchi and vessels enter. Drain intrapulmonary nodes, inside lung parenchyma.
Wait, oh,
and
this is
collect
too
lymph.
much. This is too much. Let's break this to, like, I don't know, 10 messages back and forth. So, and give us some kind of system, dude. I don't want to learn them just abstractly.
Got it. Let's simplify and spread it out over 10 back and forths, building a clear system for lung lymph nodes. First, the basics. Lymph nodes around lungs drain lymph, immune fluid, from lung tissue, pleura, and bronchi, catching infections or cancer cells. They're grouped by where they sit in the thorax. Main groups. 1. Hilar, bronchopulmonary nodes, at lung hilum, where bronchi enter. 2. Mediastinal nodes, central, near trachea bronchi. 3. Drainage ducts, parathoracic duct, right lymphatic duct, bronchomediastinal trunks. Let's start with hilar nodes. They collect lymph from inside lungs. Clear so far? Want to dive into hilar nodes next?
I don't get it, dude.
No worries. Let's back up and simplify further. Lung lymph nodes are like filters catching bad stuff, infections, cancer from lung fluid. They're organized by location. Hilar nodes at lung's entry point, mediastinal nodes in chest's middle, and ducts drain to veins. Hilar nodes, aka bronchopulmonary, sit where bronchi enter lungs, draining fluid from lung tissue. Think of them as the first checkpoint. Clear now? Want more on hilar nodes or the next group?
Is there like a sequence of nodes, or is it just for different things? I want to get the big picture of it.
Good question. Lung lymph nodes follow a sequence, draining lymph in a specific order from lungs to bloodstream. Big picture. Lymph starts in lung tissue, flows through nodes in a chain, then to major ducts. Sequence. 1. Intrapulmonary nodes, inside lungs, plus 2. Hilar, bronchopulmonary nodes, plus 3. Mediastinal nodes, plus 4. Mediastinal nodes, plus 5. Mediastinal nodes, tracheobronchial, paratracheal, near trachea, plus 4. Ducts, thoracic duct, right lymphatic duct, bronchomediastinal trunks, to veins. Each group filters lymph from specific lung areas, but they connect in a flow. Clear? Want to zoom in on the sequence or a specific node group next?
That's fair enough. That's fair enough. Okay. So let's talk a bit about the respiratory tree. So starts in the neck.
All right, let's shift to the respiratory tree, tying it to lymph nodes later if you want. The respiratory tree is the airway system, starting at the trachea in the neck, below larynx. Trachea splits into two main bronchi, one per lung at the carina. Bronchi divide into smaller bronchi, then bronchioles, and end at alveolar ducts and alveoli in the lungs. Structure. Cartilage in tracheobronchi keeps them open. Bronchioles use smooth muscle. Function. Conduct air to alveoli for gas exchange. Lymph nodes, like hilar, sit along the tree, draining airway fluid. Clear? Want to focus on a part like bronchi or alveoli?
Well, so what's the difference between terminal and respiratory bronchioles? So we have a conducting portion and a respiratory portion.
The respiratory tree has two zones, conducting and respiratory. Conducting portion, trachea to terminal bronchioles, moves air, no gas exchange. Terminal bronchioles are the last conducting airways, small, no cartilage, end the air delivery path. Respiratory portion, respiratory bronchioles to alveoli, does gas exchange. Respiratory bronchioles have some alveoli budding off, starting oxygen CO2 swap, leading to alveolar ducts and sacs. Difference? Terminal bronchioles just conduct air. Respiratory bronchioles begin gas exchange. Lymph nodes, e.g. intrapulmonary, drain both areas. Clear? Want more on their structure or function?
So let me ask about the trachea. So they bifurcate at the level of the sternal angle. And what is this carina? And what do these C-shaped cartilage rings do?
The trachea, starting in the neck, splits into two main bronchi at the sternal angle, T4, T5 level. The carina is the ridge where the trachea bifurcates, a sensitive spot triggering cough if irritated. C-shaped cartilage rings, 1620 in the trachea, keep it rigid, preventing collapse during breathing, while the open back, with smooth muscle, allows esophagus expansion for swallowing. Hilar lymph nodes sit near the carina, draining nearby lymph. Clear? Want more on trachea anatomy or lymph connection?
I don't get it.
No stress. Let's simplify. The trachea, windpipe, in your neck carries air to lungs. At the sternal angle, chest level, T4, T5, it splits into two bronchi. The carina is the sharp point inside where this split happens. It's touchy, so irritants there make you cough. C-shaped cartilage rings hold the trachea open like stiff hoops, so it doesn't
I
collapse.
see. And what do we mean when we say primary bronchia and secondary bronchi?
Primary bronchi, main bronchi, are the two big airways the trachea splits into at the carina, one for each lung. Right shorter, wider, left longer, angled. Secondary bronchi, lobar bronchi, branch from primary bronchi, one per lung lobe, three in right lung, two in left. They carry air deeper, with cartilage for support. Lymph nodes, hilar, bronchopulmonary, drain lymph near primary, secondary bronchi. Clear? Want
And the
more on their
tertiary, we have tertiary slash segmental.
tertiary bronchi, aka segmental bronchi, branch from secondary lobar bronchi. Each serves a bronchopulmonary segment, 10 in right lung, 8, 10 in left, smaller lung units. They're narrower, still have cartilage, deliver air to specific lung segments. Hilar and intrapulmonary lymph nodes drain lymph from these areas. Clear? Want to tie this to lymph flow or move to smaller airways?
How many bronchopulmonary segments do we have?
The lungs have bronchopulmonary segments, each served by a tertiary segmental bronchus. Right lung, 10 segments, 3 in upper lobe, 2 in middle, 5 in lower. Left lung, 8, 10 segments, 4, 5 in upper, 4, 5 in lower, varying due to heart space. Total, round 18, 20 segments. They're functional units, drained by intrapulmonary and hilar lymph nodes. Clear? Want more on their role or lymph connection?
So the bronchopulmonary segment is the largest subdivision of a lobe. And we have 10 in the right lung and 8 to 10 in the left one. And each of them is supplied by a single tertiary bronchus. And they're a single branch of the pulmonary artery too. So if we can remove one surgically without doing a lot of problems to the other ones.
Exactly. You got it. Bronchopulmonary segments are the largest subdivisions of a lung lobe, 10 in the right lung, 8, 10 in the left. Each is supplied by one tertiary segmental bronchus and a dedicated pulmonary artery branch, plus veins and lymphatics, drained by hilar and intrapulmonary nodes. This setup makes them functionally independent, so one can be surgically removed, segmentectomy, with minimal impact on others, preserving lung function. Clear? Want more on surgical aspects or lymph drainage?
Yes.
Cool. Segmentectomy removes a bronchopulmonary segment, e.g., one of 10 in right lung, 8, 10 in left, for issues like tumors or infection. Each segment's isolated bronchus, artery, and vein, drained by hilar and intrapulmonary lymph nodes, allow clean removal without bleeding or air leaks affecting other segments. Lymph nodes are checked for cancer spread, preserves more lung than lobectomy. Risks, infection, minor function loss. Clear? Want more on complications or lymph node role?
Tell me about how many generations of conducting bronchioles we have, and what does generation mean in this place. And you didn't mention much about the C cartilage we have where the trachea is. If you could talk about that too.
All right, let's cover conducting bronchioles, generations, and revisit tracheal cartilage. Generations refer to airway branching levels in the respiratory tree, starting at the trachea, generation 0. Conducting bronchioles, no gas exchange, just air delivery, begin after tertiary bronchi, around generation 10-15, and go up to terminal bronchioles, roughly generation 16-20. About 10-15 bronchiole generations total, varying by lung region.
Okay. Thank you for watching, guys. I hope you enjoyed it.